Part 27, Giving Breaths. Welcome to the lesson on giving breaths. In this video, we will discuss the steps of giving breaths. Giving breaths. Giving breaths during CPR can help maintain a supply of oxygen in the lungs. Oxygen in turn is circulated to the brain and to the vital organs by chest compressions. Using a mask is preferred. A correctly executed breath will cause the individual's chest to rise. Opening the airway. To open the individual's airway. Step 1. Place one hand on their forehead, and your fingers on the bony part of their chin. Step 2. Gently tilt the head back while lifting from the chin. How to give breaths. Step 1. Hold the individual's airway and pinch their nose shut. Step 2. Take a deep breath and seal your mouth around their mouth. Step 3. Blow into their mouth for 1 second and watch their chest rise. Step 4. Repeat with the second breath. If the chest does not rise, reposition the airway, let their head go back to a normal position and then repeat the head tilt chin lift maneuver. Then give another breath and watch for the chest to rise. Perform chest compressions without interruption. It should take no longer than 10 seconds to give 2 breaths. If the chest fails to rise within 10 seconds, begin chest compressions again. This concludes our lesson on giving breaths. Next we will review mask cues.